Hearing loss in kidney diseases? What you didn't know. Will the poor health of the kidney damage hearing? Yes, they can work in more ways than one. However, this side effect of chronic kidney disease is not talked about very often. Hi, this is Dr. Amrita, and you're listening to the Health Wealth Bridge podcast. Sensorineural hearing loss in chronic kidney disease is common. Hearing loss often happens due to the illness itself and sometimes the ototoxic drugs needed to treat the kidney disease. It happens from 27 to 77% of people suffering from chronic kidney diseases. The percentage may vary between countries depending on the burden of non communicable diseases. Hearing loss is often long lasting and worsens over time. All chronic kidney disease patients need regular hearing assessment to guard against this and treat it accordingly. Timely intervention can prevent and protect hearing. What kind of hearing loss is seen in CKD patients? Sensorineural hearing loss, as I mentioned, moderate to severe, involving higher frequencies, is seen in CKD. It's bilateral and symmetrical in most cases. Hi, this is Dr. Amrita, and you're listening to the Health Wealth Bridge podcast. I'm an ENT surgeon, and hearing loss is a complaint that many of my patients have. It's important to take a careful history to rule out kidney disease of any kind. Tinnitus or tinnitus is a ringing sensation in the ear and may also be associated with SNHL or sensorineural hearing loss. CKD patients are at 3 times greater risk of tinnitus than the general population. A patient may also present with sudden severe hearing loss. While evaluating hearing loss, it's necessary part of the workup to include questions about comorbidities and ototoxic drugs. This will include non-communicable diseases like hypertension, diabetes mellitus individually and together, as they both produce a risk of lowered hearing. Ototoxic drugs are toxic to the ear, but often necessary to treat the chronic kidney disease because they are life-saving. It is a classic case of side effects where the risks and benefits of treatment are weighed in. Loop diuretics and aminoglycosides are common drugs that can cause hearing damage. But how exactly does kidney disease affect the ears? Systemic diseases can affect every part of the human beings. All systems are related, and when it comes to nerves, they are extra sensitive. Our kidneys remove the waste toxins from our bodies. They also play a role in balancing the electrolytes. The cochlea in our inner ear are responsible for hearing. They have fine hair cells and a delicate ionic balance which gets disrupted by uremic toxins, distorted ionic balance, and ototoxic drugs that are used to treat severe kidney infections. Hemodialysis in some instances can also cause the same condition due to multiple factors. The effect of all this may be superadded to damage the cochlear hair cells. It may present as a ringing sound in the ear, reduced hearing, blowing sound, any other kind of sound might also present as an indicator of progressive problem in the ear. Your nephrologist will advise about the ototoxic nature of certain drugs and the need for an ear checkup. During the early stages of mild hearing loss, you may not realize the problem. However, tuning fork test and a pure tone audiometry by a registered ENT surgeon will help diagnose it. When to visit an ENT surgeon if you have a CKD? An annual pure tone audiometry needs to be a part of the CKD treatment. Get tested on time. At least an annual ENT checkup and a pure tone audiometry screening is required. In case of reduced hearing in one or both ears, you need to get a ENT checkup. In case of a ringing sound in ear 2, you need to get an ENT checkup. If it's a sudden acute hearing loss, you need to get an urgent checkup done by an ENT surgeon because there is a golden period of 72 hours when certain drugs work best to get your hearing better. If you have a problem with balance in case of a change of medicine or after hemodialysis, it's always better to have an ENT checkup. How to prevent further hearing damage? A regular hearing assessment is the best way to prevent or treat early. Better control of the blood urea, creatinine, serum electrolytes, better control of the comorbidities, avoiding acoustic trauma, and avoiding ototoxic drugs, especially as and when it is possible. What to do in case of a hearing loss? If you suspect you hear less or are a CKD patient, caregiver, visit an ENT surgeon. Your doctor will check the eardrum duotuning fork test and advise the following tests like a pure tone audiometry, a short increment sensitivity index, a tone decay test. In case of hearing loss, a hearing aid trial and suitable digital hearing aid are advised. What other things will your doctor tell you if you have hearing loss with CKD? Counseling and need for family awareness is crucial. A support system and community to encourage productive habits. Avoid topical or systemic ototoxic drugs, which can cause a further worsening of the condition. Neurovitamins, strict control of blood pressure and blood sugar will prevent superadded damage. Maintain ear hygiene. Avoid pond bathing, diving, self cleaning of the ear, and forceful valsalva. The strict control of other non communicable diseases like hypertension, diabetes mellitus is essential because they will cause increased nerve damage. Increasing age and age related aggravation of sensorineural hearing loss are typical. Like all diseases, prevention is helpful. You are listening to Dr. Amrita on the Health Wealth Bridge podcast. You can find me also on YouTube at Health Wealth Bridge.